Let's go to the next study. This one is very interesting one, and it's coming from your native country in Greece.
Yes, this is an interesting study, and I think it's a study that caught some people almost off guard. It's titled Deaths Due to COVID-19 and Deaths with COVID-19. They had due to and with in quotation marks during the Omicron variant surge among hospitalized patients in 7 tertiary care hospitals in Athens, Greece. So this was published in Scientific Reports, another peer-reviewed journal, a rather large journal from what I understand. And it was published last month. So once again, it's a recent study. There were 19, to be exact, Greek doctors and researchers that co-authored this paper. And what's interesting is, I'm saying this anecdotally, I think at least one of the co-authors, and I think he's the corresponding author of this study, was on the Greek government's official COVID-19 recommendation committee during the pandemic. So this was someone that was actually involved, if I'm not mistaken, with some of the policymaking during that period. So this study looked at people that died in 7 hospitals in Athens during a period of time. I think it was about 8 months in 2022. It was during the Omicron variant surge. And these were deaths that were recorded as COVID deaths. And what was found is that most of the deaths that were recorded as COVID deaths were actually not directly due to COVID-19. They were just people that happened to, be infected with COVID or to have a positive COVID test. But their actual cause of death, if you actually look at their medical records, which is what these researchers did, they looked at the medical records, they interviewed the physicians that were caring for these patients, and based on that analysis, they determined that about 45% of the deaths occurred among people with COVID-19, but could not be directly attributed to the virus. 25% of the deaths, so only 1/4, were deaths where COVID was found to be directly responsible. And then about 29.6% of the deaths were cases where COVID was found to have contributed to the death, but was still not the main cause. So the main takeaway here is that, we were hearing these big numbers during the pandemic, this many people are dying per day, per week. And it was sort of, everyone was kind of lumped together. If they happened to just have COVID or have a positive test, then the media and, the public health agencies were just saying they died because of COVID. And what these results show is that, at least in this sample, 3/4 of the people did not die directly because of COVID.
From the start, we didn't make autopsies, all of them. They said that they're afraid of virus, but I'm not sure how they can be afraid of something what is dead, in the dead body. At the same time, we had a study from Germany that shows that non-single pathologists get sick from the autopsy of that person who died from COVID. And that is the only way how to prove that somebody died from COVID. But unfortunately, it seems to that they are tracking just tests. And now, if it's true that 45% of people were not, didn't die from COVID, that means that we had inflation of documents, of papers, and that's why we had measures that are not suitable for real numbers. And what is most important, whenever somebody asks, for example, politicians who were involved, let's reanalyze and say what was happening during COVID. And everybody said, how can you ask when so many people die? In Croatia, that was 18,000. But it was really 80,000. Let's check it out and see what are the numbers reality. And we see here, according to this Omicron variant, that these numbers are different. Maybe from side of Alpha and Delta variant was something different. But we need to check it out and see what really data is telling us.